Oh, yes, it's come on. Brilliant. So what to now I've lost my words. That's a good start to recording. So welcome to the never-ending tale of digital health and well-being. It's a real pleasure for me to introduce Matt and Emma of LiveWell Dorset, who are trying to encourage us all to lead healthier lifestyles and using digital to help with this. So I think I'm handing straight across to Matt to start. So welcome, Matt.
Thank you. Big thank you from both of us. It's great to be here in the Festival of the Future tent. A couple of points just to kick us off. We're going to screen share this presentation, as you can see, for all you visual learners, but if you prefer to just look at our faces, click on the row of faces at the bottom of your screen and you can flip between the two as many you want. We're going to move at pace through this presentation, so if you want to know more about anything that we touch on, please do follow up this afterwards. Very happy to answer any questions. Emma.
Yeah, good morning, everybody. So first and foremost, let me tell you who we are, who LiveWell Dorset is. We are a public health service that supports adults across Dorset to drink less, quit smoking, move more and manage their weight. So we do that by combining traditional health services with evidence-based behaviour change intervention. So in a nutshell, as well as helping people with their physical health needs, we also address the habit or the unhealthy behaviour that got that person to where they are in the first place. And we use models of behaviour change throughout the service. Our most commonly used model is one called COM-B. I don't know if that's one you've heard of. If you haven't, just to let you know that COM-B stands for capability, opportunity and motivation. And the idea behind it is that if people are feeling confident in each of those areas, then they should be able to make a change. But if they've got a challenge or a barrier in one of those areas, then they will need to deal with that before they move forwards. And this model matches up those barriers, those challenges with evidence-based tools and techniques. And we use that in our health coaching. That's based on that model as well.
So believe it or not, 90% of us have one of these 4 unhealthy behaviours. 70% of us have 2. And you might have heard the term prevention at scale as part of the NHS's long-term strategy. Well, LiveWell is part of our work in this in Dorset. And there are 2 ingredients that make prevention at scale reality. Firstly, self-management, that a portion of people will self-serve with little or no human contact points. And secondly, digital. And when you combine digital with self-management, we make the vision of prevention at scale reality.
Absolutely. And you might be wondering why we picked the NeverEnding Story. For us, digital tech is the never-ending story. And I wanted to, when we were planning this session, I kind of had this idea to start with a once upon a time and finish with a happy ending. And whilst there have been really happy moments and we've achieved some really great things along our digital development journey, spoiler alert, there is no happily ever after, because the never-ending story is just that, a never-ending story, and that feels like a good fit for us. It's not that we don't get good outcomes, but it just feels like there's always more to be done. I don't know how many people know the story or seen the film. I kind of vaguely remember it from my childhood. It was actually released in 1985, but I watched it probably in the 90s, and that's when it sort of made an impression on me. And it's the story of this young boy who's being bullied, and one day, to avoid the bullies, he basically ducks into this little bookshop. And while he's in there, he's digging around and he finds a book called The Never-Ending Story. And he begins to read this book in the school attic, actually. And it's a story about this fantastical place called Fantasia. And it's threatened by the nothing, this darkness that's going to kind of destroy everything. And it needs the help of a human to survive. And Bastian, this young boy, reads the story of the main character and he has this connection with what he's reading. And he starts to wonder if it's real. And he goes off on this massive adventure and does all sorts of weird and wonderful things, and amazing things happen and challenges are overcome. And then at the end of the book, he goes back to the bookshop that he stole the book from, and he confesses that he stole this book. And initially the owner says, oh no, I don't know anything about that book, but eventually he admits that he'd also been to Fantasia, and that actually the book had moved on into the hands of somebody else, most likely. And it concludes with this idea that this is another story that should be told another time. And I can say with pretty pretty much amount of certainty that Matt and I have never battled with magical creatures.
Just my kids at bedtime.
The joys of parenting, hey Matt. But we have been battle weary on our digital journey, and so today we wanted to share some of our story with you. And our first point has two parts to it. Number one is that the digital story in frontline health really does have no ending, and in order to be successful in the digital world, we mustn't just be turning pages until we finish the book. We need to be scanning the horizon for inspiration and ideas. We could even say plot twists as well. And it's not just about planning the next sequel, it's also about planning the next chapter. So one of the key things for us has been, when we're thinking about what we want to do with our service and where we want to go, it's making sure that we're working with people who have the same idea as us, that they want to be flexible and can be adaptable to our changing needs. That's really important to us.
And secondly, the client story is also never ending. So being a healthy person requires a lifelong commitment. It requires daily steps to live well. And this is the second reason that we need to remain flexible. Our service needs to meet the needs both here and now, and to cater for technological, sociological advances in order to remain relevant in the future.
Yeah, and so today we are going to talk you through 6 different chapters. And we're starting off on chapter 1, which we've called The Call to Adventure. And so this is about the beginning of the story. How does the story start and what motivates people? How do we encourage people to engage with us at LiveWell Dorset? A bit like Bastian in the NeverEnding Story, whose life was changed by this singular event. He was being bullied, and on that particular day, he was really fearful about getting hurt, and he made decisions that then changed the rest of his life. And our clients often come to us when facing a similar pivotal life-changing moment or some kind of wake-up call, and that could be a health diagnosis or a near miss, a bereavement, a divorce, some kind of event that stops them and means that life needs to change direction.
Let me tell you about one of our clients, Martin from Poole. Martin's an office worker who led a largely sedentary lifestyle, which led to his pivotal life-changing moment, a diagnosis of type 2 diabetes. Through daily 5-kilometre walks to the beach and back before work, he's changed and changes to his diet. He's lost 2.5 stone and has transformed his health. He uses an app, Nap My Walk, to track his progress, and his mum uses the same app, so they encourage each other along their way. He's got a long-term condition, so he's in the high-risk category for COVID, but by losing all that weight and transforming his physical health, he's in a much better place to face any nasty illnesses such as coronavirus. In his own words, there's still a way for him to go, but he's on the journey. He's taken each next step towards living well.
Yeah, and it's not just about those people who are facing life-changing moments. We also need to be in a position to help the browsers who might, whose trigger might just be an interaction with us. They may be sat in a doctor's surgery and see one of our posters on the wall, or they might even just be looking at our website and see something that really stands out for them and motivates them to take a step. So our chapter 2, our second chapter, we've called Meet the Guide, and here we're talking about how do people meet LiveWell Dorset. Our website, I suppose, is our digital bookshop window. So something about the shop window in Bastian's story made him enter that day. And so we need to make sure that our shop window displays something that means people want to enter into our service and take a step towards having a healthier lifestyle. And so now we're just going to talk you through some of the technology and spaces that support that, and also touch a little bit on how behaviour change comes in.
So our half-year-old website typically sees 12,000 people accessing it each month. It's the first point of contact for the majority of our clients. It's our shop front, containing a whole host of information and inspiration to help you take your next step to live well. I like to think of it as a series of hooks and ladders, hooking people in to make them think, and ladders that lead them upwards and onwards on their journey.
And we mentioned early on that we're a behaviour change service, and so we want to make sure that every single opportunity there's influence and foundation rooted in behaviour change science. So quite often people won't even be aware that there are interventions happening, but I can assure you there are lots, and lots of thought has gone into every part of the website, including the content and the messaging. And it's full of information and opportunities to interact, which we hope will encourage people to take steps towards living well. One of the tools that we've got on there is something called our Habit Hacker. And that is an interactive tool which helps people think about the goal they'd like to set and then any barriers that are stopping them from reaching that goal. So for some of our clients, they're going to use that. That would be like a little nudge for them, and that would be enough for them to kind of go off and start their journey. For others, that's going to be the stepping stone into joining the service itself and receiving additional support if that's what they need. It does use the theory of COMBI that I mentioned earlier. And what happens is if they do decide to sign up with us as a result of doing the quiz, those their results from the quiz are then integrated into our CRM so that our team can then see what it is the client wants help with. And that means that clients don't have to repeat themselves. So the web platform and the CRM do talk to each other.
Over the past 2.5 years, LiveWell itself has undergone a transformation as client registrations have gone from 100% over the telephone to today when more than 80% of registrations come through our website. And it's important to note that this is client choice. More than 80% of people choose a digital first interaction. And we've opened up the ways by which people can contact the service. So in a typical month, we through the website, from Facebook Messenger to website chat. We've now got 2 full-time digital customer service colleagues who lead on these inquiries. And that web chat is no new thing, but I think it's a really important part of ensuring that our website is friendly, welcoming and accessible. It supports people who are hard of hearing or perhaps fearful of picking up the phone. The analogy I often like to think of here is that you wouldn't leave a high street shop open but unmanned, although perhaps the high street of the future will do that one day. Web chat is showing that we are manning the shop. We're there, we're ready, we're willing to help.
Yeah, absolutely. And another thing that was really important to us is that we wanted our digital offer to be about more than just our clients. We also knew that we had a number of stakeholders who rely on our website. And so we wanted it to be a really useful place for them and for anyone really who was invested in population health like we are, so GPs or other health professionals. And so quite early on, we undertook a consultation piece of work talking to those partners. And actually, we based the whole consultation on the behaviour change COMBI model, looking at what the challenges were for those health professionals in connecting people with our service. Just 3 years ago, I think it was, we were using very old-fashioned faxes as a referral process. So it was really important we moved away from that, but that we also took our partners with us. So in talking to them, there were 3 sort of things that came out that were important to them. One was that it needed to be really quick and easy to use. Obviously, they're under a lot of pressure when they're having those consultations, and so they wanted something that was just really simple. They wanted to feel like they'd taken some kind of action. So a bit like when they write a prescription and they've taken a tangible, given that person something. They wanted to feel like in connecting with us, they'd taken an action. And then finally, they wanted to know what had happened to their patient afterwards. And so we built a simple tool called Contact My Patient. It's an online tool that health professionals can use during the consultation, and it literally just takes a minute or so to use. We provide a widget so people can embed it onto their website or to their systems. They don't have to navigate away. It can all be done in the same space. It requires really basic patient details. So once entered, the patient receives a text message or an email literally within minutes. So that lets them know that they've been referred to LiveWell Dorset, and it contains a link to register. And so all of that can happen quite often while the patient is still in attendance. The other thing it does is it allows us to track who's made the referral. So whether the patient opened the link, whether they went on to register, meaning that we can feed back to that health professional on the outcomes. It kind of closes the loop. The other thing was that part of COMBI and behaviour change is that we want to encourage the person making the change to take this first step. And so by them receiving the text message, they were, by contacting us, committing to the next step in their own health journey. It's been used more than 3,000 times so far, and it typically has a conversion rate of around 15%.
You can see the behaviour change inputs in our social media and our communications too. So we know that it takes multiple modes of contact before someone's ready to start their journey and to commit to make a change. So through the website, our social media and our marketing, we coordinate and orchestrate these multiple modes of contact. We trust the algorithm by serving up tens of different Facebook ad combinations of copy and media to multiple audiences, allowing the algorithm to understand who's going to best respond to what message or media. It thinks faster without bias or preconceived expectations. We'd like to speak to what people are searching for too. So one recent win was when our "How long does it take to quit smoking" article hit position 0, or a featured snippet on Google for that search term. And this is the gift that just keeps on giving. It's been responsible for 12,000 hits to the website, and it's been sending lots of good vibes to Google and improving our search engine results page ranking. So we've got hooks such as this content, the habit hacker, or as you can see here, the "Are You Living Well" quiz. These are all important, but we can't forsake or forget about the offline mediums too. Our strongest source of referral is word of mouth from a friend, and the prompt from a trusted healthcare professional at a teachable moment, perhaps someone visiting a relative in hospital and picking up a flyer in the waiting room. My aspiration is that of hyper-local, hyper-personalised moments of contact. So when you walk into your local pub, you find a beer mat there saying we've helped 84 people in this postcode area to lose weight, combined with something popping up in my Facebook feed as one client put it to me, and an advert on your skybox for a specific postcode area. We've got a way to go, and while digital is the go-to, perhaps because it's quick and easy and measurable and comparably cheap, we can't solely rely on digital. It works best when it's combined with traditional offline methods too.
So on to chapter 3, transformation. So we've touched a little bit on some of the things we do to kind of entice people in, and then the next step is hopefully that they embark on some kind of journey of transformation. So our digital interventions don't stop once they've become a client. We try and use tech throughout our time, their time with us, and so we're going to talk through a few examples about how we do that. It's probably a good point to just note as well that we have 0 face-to-face clients. All our support is offered remotely. So one of the places that we do really engage with our people is a group called Our Live Well, which is a closed Facebook group. It's open to any adult in Dorset who wants to make a lifestyle change. And we know Facebook's got nearly 44 million users across the UK, so it's really important for us to have a presence there. The idea behind the group kind of came out of an idea of trying to create some kind of support network or community for our clients or for people wanting to make a change. And our clients have told us that accountability was really important to us. They wanted a space where they could celebrate success, but also share some of their challenges and just speak to others who were perhaps going through something similar. And so when people register with the service, we often welcome them to and join the Our Live Well group. I should say we do have a few people as well that will join the group and then take that step into the service. And in recent client interviews, many people were referencing the Facebook group as a really important part of their journey with us. It's 2 years old now and it's got nearly 3,000 members, so it's doing all right.
Thanks. And the future of Facebook is definitely Facebook groups. So 66% of Facebook users use a group at least once a month. The algorithm favors this content. But I guess a little caveat from me here on this point is just that relying on Facebook or any other platform is a bit like building a house on rented land. They have the power to change things overnight, anytime. So I always come back to how building an email list has got to be the priority. There was a painful moment for me in some recent usability testing when one of our clients said they remember this group, but why didn't LiveWell send them a regular newsletter or email on a regular basis? And that's something we do. So it was I guess a registration that person decided to not opt in to that thing. So it's important for me to remember that we need to keep reminding people in the group to come and share and subscribe to those email lists. For me, what this group is all about is about the peer-to-peer nudge. I think a LiveWell nudge to a client can only go so far, but a peer-to-peer nudge can sometimes have more weighting or influence. So with very little influence or control, we've created a space for people to inform others of what they're doing and inspire other people to start a change. People such as Owen, who saw a conversation about this thing called Catch 5K in the group, And he thought, you know what, I could give that a try. Owen is a cancer survivor. He was a photographer who was at a risk of losing his eyesight due to type 2 diabetes. So he'd initially lost 5 stone in weight through our coaching and weightless kickstart. So he's transformed his physical health and now runs 5 kilometers most weeks. So we had that nudge to take care of his health and take that next step to live well by downloading the Couch to 5K app.
Oh, that's such a good story. And you mentioned the app there, Matt, and apps are a really important thing for us at the moment, something we're exploring about using more of. We've partnered up with Dorset's integrated care system, Our Dorset. So that's a collective of NHS, CCG and local government services. And we've started to look at how we might use and promote apps as tools for people to self-manage their health. And that could be, an app to manage a long-term health condition, or to teach somebody about healthy eating, maybe even something like sleep hygiene. There's so many apps out there, and actually they can often be used as a complementary, or in some cases a substitute tool for management, obviously depending on the person's circumstances. So we've invested jointly in a piece of tech that allows people access to accredited apps. It's the Our Dorset app library, and we partnered up with a technical company called Orca, who basically verify apps for us. I'm just going to give you a moment to have a little think for yourselves here. You might want to just try and guess how many health apps there are in the App Store. So think about where you would normally download your app from the App Store. Think of all the apps in there. Have a little moment to think about how many health apps might be available from that store. Hopefully you've got a figure floating around in your mind there. There are actually 367,000 different health apps available on the market at the moment. So you can imagine what a minefield that is for people. People are generally downloading, there are around about, 5 million people downloading health apps every day, 5 million people every day. So Orca, the people we work with, have a quality assurance framework to verify apps based on things like security, usability, accuracy of information, etc. And it was a bit of a shocker for me when I first started working with these guys, because actually of the apps that they looked at, only around 15% hit the quality mark and were then put into the app library. So for me, that's a real shocking sort of figure. So having that Our Dorset app library really does give peace of mind, and that's for our clients and for us. And I know that for the for my team, for our frontline advisors and coaches, it means that they feel they can safely and easily recommend apps. They just need to enter a client's contact details. It sends a link to the person with them for them to be able to download the app. And for me, just that simple tech really closes the gap, makes things a bit more seamless, but also makes it a lot safer for everybody involved.
Then there's My LiveWell. So this is something that everyone who registers on the website gets. It's your own personal profile and place to track your LiveWell journey. It isn't yet an app. That's a chapter yet to be written, but it functions like an app. And as one client put it to me, its aim is to hold me to account. And hands up, we've made some mistakes along the way with this. We're on version 2 of My LiveWell, as the quality and interface of version 1 just wasn't there. It's still a work in progress. We've recently brought in a partner to complete some invaluable usability testing and research, and there's lots more to do. I think our lesson learned there is let's avoid needing to redesign the redesign. We are an enthusiastic bunch with lots of ideas, and we like to make stuff happen. We like to move fast. And with My LiveWell, we did rush and skip that first crucial step of gaining user feedback early on. We took the briefs to our developers and they helped us build it, but we didn't really take time to really understand what clients needed.
Another key sort of investment for us from the last year was an upgrade that we did to our directory of services. We've called it the LiveWell Finder. So we wanted to move away from having just a basic list of activities that people could access, having a wider information resource that could be used both by members of the public and by our stakeholders. And one such person that used it was a client called Julia, and she used the Finder to start her journey towards becoming healthier. So she was browsing it one day and she saw a little ad for a walking netball group, And in her younger years, she had been captain of the school netball team. And so seeing that post was the nudge to inspire her to get in contact with that group. And fast forward, in her words, her lung capacity has increased. She's got a new group of friends, and her confidence has also increased. And she's, tried a new challenge. So this kind of self-serve offer has been really great for us. There's no contact required from any sort of team member at LiveWell. And actually it means that people can access it and go off and start their journey. So there may be many, many other Julias out there we don't know. I hope so. It's a great tool.
The LiveWell Finder is a tool and a resource for our partners too. So we are working on a widget. So our partners such as Dorset or GP surgeries perhaps can embed it on their own websites. And we've used a common data structure to give scope to use APIs and to share that information with other directories and services. We are all about working with others, not reinventing the wheel, but partnership and collaboration. Those are really key things for us.
And as well as some of these bigger things, we do use everyday tech to aid our efficiency and problem solve wherever possible, because we realise it's such a good way an efficient way to improve what we do. And we haven't got time to go through all the things that we do, but the types of things that we've used it for would be, like, we had a situation where we had a number of no shows for appointments, so people weren't showing up for their sessions with our coaches. And so we put together a very simple SMS reminder that's linked to our CRM, our client database, and that really helped us to reduce lost time. So tech is a really important thing for us, and we do try and use it wherever we can. Okay, chapter 4, twists and turns. So every story needs a plot twist, doesn't it? And I think ours came this year in the form of COVID-19, and I'm sure that that's been the case for probably a lot of you. Our stories, I feel like, took a bit of a turn for the better, and there are a couple of things that really stood out for me I wanted to share with you. They're both sort of linked to our adaptability, really. The first is that we had a traditional kind of contact centre, and we literally lifted and shifted that to a working from home model overnight with very minimal disruption to the service. I might even be as bold to say as no interruption to the service. It was really smooth and easy to do, and I think that's in part down to previous investments that we've made into simple tech like soft phones. We're always looking ahead, and we had a system that meant that we weren't reliant on a building. We could literally work from anywhere. I think the second thing that stood out for me with COVID is that you can spend years investing in and developing tech, and we've done that. There have been times where we've really taken a lot of time and gone backwards and forwards, but actually along comes a crisis and suddenly you get permission to work in a different way. And for us, it's proven that we can work at pace and produce some really outstanding results. One of the things that we found ourselves dealing with quite early on in the pandemic was needing to respond to a gap in health services, which opened up when pharmacies had to pause some of their services. So for us, obviously, helping people to quit smoking is one of the things that we do. And one of the ways that we had done that previously was to connect people with community cessation services within their local area. And suddenly those weren't available anymore. And that was at the same time where actually people were starting to think about their lung health. This COVID is a respiratory disease, and so people were wanting to think about giving up smoking and improve their lung health. So we launched a Quit for COVID campaign, and we set up a series of texts to people that we knew smoked from our own database, and then we basically offered to post them NRT products and give them some behaviour change telephone coaching alongside that. And we managed to turn that project around in just under a month. And that's bearing in mind that we had never sent out or dealt with NRT ourselves before. So that felt like quite a good achievement. We've helped 500 people to quit so far this financial year. And the really amazing thing is that 87% of those people are still smoke-free at 4 weeks. And for those of you who know about this stuff, that means that they will increase their chance of quitting for good by 5. We then went on to partner up with primary care networks across Dorset, who had seen some of the success that our offer was having and wanted to work with us. And so then our role was to support them to text their own patients or contact their own patients and signpost them back round to us. So there is scope to do a bit more of that, and this is probably one of those watch this space moments, because there's still a lot of untapped potential there. It just shows what you can do under pressure.
The second good news story of the past 6-7 months is that of the 5 Ways Challenge, a behaviour change campaign. It's supporting existing and not yet clients, and you can still join the challenge if you'd like to. Introduced at the start of lockdown, it's led more than 2,000 people on a journey to take care of their health and well-being through this challenging time, and it's all been done through an email sequence. And I used that word journey intentionally. We're all about cheering people on each next step towards living well. And some of our 5 Ways participants were part of the 1 million people who downloaded the Couch to 5K app during lockdown. Others tried home workouts, mindfulness, or taking notice of nature around them. And we used that teachable moment of COVID to really support people and help people at this time. It feels like there's a national movement towards better health and well-being, and it's all about sustaining these habits and making those steps achievable, normal, and part of everyday life.
Yeah, absolutely. The third thing that we did was we normally have a training and engagement team that would be going out into the community and out into workforces, offering training all around health and well-being. And obviously they had to join the COVID response like the rest of us. And we managed to replace our previous face-to-face workshops and turn them into virtual workshops, again, relatively quickly. And we've already trained 1,200 people just in the last 6 months. So for us, that's been a really good way to learn and use technology to support that. And I think we're pretty committed now to making that our primary delivery method going forward, because actually there's been so many pluses to having that technology. And it's also been great for us to be able to support local government, NHS colleagues, businesses, workforces, where in a time where actually health and well a really important topic that they need to be thinking about and talking about. So being able to get that to them at this time has been brilliant. Chapter 5 is around permission to create and innovate. And I feel really proud of what we've achieved at LiveWell Dorset in the last 2.5 years since we became a public health service. And I think there's a few simple things that have helped us to be successful. And so just wanted to share some of those things with you now. The first thing is about our team really is that we really encourage innovation at every level, and it's not just a bunch of people sat in a closed room kind of coming up with ideas. Everybody has a voice in our organisation, even our unleaders, and I don't know if that's a term you've heard of. There was a piece of research completed actually since we've been locked up during COVID around leadership, and the research named people whose job it isn't normally to lead, and who don't lead people, but who for some themselves leading change during COVID. They labelled them or called them unleaders. And I really like that term, because I think we've got a lot of unleaders within our service, people who perhaps aren't in a position to normally or in their job titles be leading, but actually they've got something really important to say. And so we want to make sure that we hear from our frontline people. We're quite a little team, which means that we can move at pace when we need to, and we do make stuff happen. But I think the important thing is that all the creativity and innovation in the world won't be successful if you don't have really good foundations. So for us, innovation needs structure. We're a very fearless team, and we have a culture where it's okay to fail, but actually our foundation, our building blocks are really important. So we're going to talk you through a couple of those now.
So 2 phrases I've come across recently that are quickly becoming new mottos for me are, firstly, that it's okay to be wrong, but it's not okay to be wrong and not know it. Let's fail fast, let's try again, let's understand what's not worked and why. With so much data and metrics on hand to track, we can sometimes spot the warning signs, but not necessarily diagnose the why behind those warnings. It's only when we understand the why behind the what, and that can also often only be found through user research. And to quote my Dorset Council colleague James Simmons from the service design team, organisations often pursue progress over understanding. Projects can demand progress or activity reports. But let's seek first to understand. Let's prioritise greater understanding first and foremost over progress. And the second motto that's coming really important for me, I wonder if anyone can have a think about what this acronym could stand for. So in a moment, I'll offer a chance for people to shout out what it might be. So often we design should-based interventions. They should know this, they should know that, they should click here. And this is so prevalent that Robert West, one of the authors of the COM-B model of behaviour change, wrote this acronym into the behaviour change wheel book. And he says that should-based interventions lead to frustration. We need to first figure out what people want and need to get to the heart of voluntary behaviour. So I wonder if anyone would be brave enough to quickly unmute themselves and throw out any ideas of what this acronym could stand for.
Oh, that's a bit scary.
It stands for, it seemed like a good idea at the time. We've got to seek first to understand user wants, needs and desires, and those are more likely going to come from qualitative data rather than numbers. I can think of times when we've implemented, it seemed like a good idea at the time, functions or features, when retrospectively with more understanding, we can see that they clearly weren't getting to the heart of voluntary behaviour.
So people are your power. I hope you can see some people on your screen now, who are my lovely team members at LiveWell Dorset. Lovely, happy, smiley bunch there. Your people are your power. So when I talk about people, I'm not just talking about your employees, I'm also talking about your partners. And so it's really important that whoever you bring in understands your vision and your mission. So we are definitely not experts in everything. We're just not. And so we have to bring in partners. Otherwise we wouldn't be able to get anywhere. And so when we're doing that, we're really thinking about picking people that are flexible and can be flexible, and at the same time people that can support our innovation too, because we're perfectly fine if direction needs to change. We feel okay with that. That's part of our culture, but we need to make sure that partners feel the same. So we're looking for flexible partners with flexible mindsets. We hold on to our ideas really lightly, because we know that change is often required at short notice. And I think the other thing is we're a very well balanced team. We've got a range of complementary skills and personalities. We've got our marathon runners and our sprinters, and that's deliberate. So when you're building your team, and that's, like I said, just your employees and your partners, you need to make sure you've got a really good mix there, and make sure you've got mechanisms to listen to all the different people that make up that network, because customer experience really does start with employee experience, and that is an absolute foundation to our innovation.
So an often said marketing phrase is that content is king, and it's true. But what is just as, if not more important, is context. And again, quoting Robert West, behaviours don't exist in a lab or a vacuum. It's so important to spend time in diagnosis, to understand from and learn from our mistakes. Don't jump into problem solving and intervention design before fully understanding the behaviour in its context. There are so many qualities to behaviour than we see at face value. Content is important, but I say that context is king.
Chapter 6, we're on this is the last little bit now, so we are coming to the end, although this slide says the end is not the end, and that's because in the story we heard earlier, the end was not the end. I'm going to tell you another little story now, about one of our clients who was an older gentleman who was signposted to us by his GP because he was overweight, and he connected with us and we offered him some health coaching. And during his sessions with his coach, it came to light that he couldn't cook, and so he was eating fish and chips pretty much every day, and obviously was putting on weight because of that. And so it was brilliant. We thought, great, we can help this chap. We can help him to learn. If it's all about skill, we can support him to find and cook some really simple meals. But then actually, when we had that conversation with him and offered him that solution, we discovered that his wife had passed away and she'd done all the cooking, hence why he was now going to the fish and chip shop. But actually, the fish and chip shop staff were the only people he ever talked to. And he really didn't want to give that up because they were the only people he saw on a regular basis, and they all knew him by name. And so suddenly we're dealing with a whole set of different issues: isolation, loneliness, bereavement. So if we hadn't taken some time to try and step back and listen, and like really listen and understand, then we might have missed what was really going on. We wouldn't have got to the heart of the problem. I'm pleased to say, by the way, that this chap is doing really well now, and we have connected him with people to help him with all the things that have been going on for him.
So we started with prevention at scale, and that's still the destination. In the future, we aspire to enable people to have a completely digital experience if they choose. And currently, clients still need human touch points to access particular parts of the service. To have a truly digital experience would be saying goodbye to those touch points. We've got some questions that we're keen to learn from clients about. So, for example, one of our key target audiences is men, and helping men to take care of them. So if we offered a digital only weight loss group experience, would they be more likely to take up that offer than a traditional weight loss group? That's a question or a hypothesis that we'd like to answer. And we mentioned that we brought in a user experience partner to complete some usability testing and research. And our future definitely involves far more user research and understanding, first and foremost. I've had some painfully true realizations or revelations and penny drop moments. Quantitative is just part of the picture. Qualitative is so important. We often favour or default to quantitative over qualitative, perhaps because it's so easy to gather, but I feel like that often misses half the picture. Seek quantitative research from 5 or 6 people, and that's worth just as much, if not all the stats in the world from Google Analytics, and that's from a massive fan of stats here. I can see clearly now how features in My LiveWell weren't necessarily true to user wants or needs or desires. And it's not a case of if you build it, they will come. Rather, if you build something they want or need or desire, they may come. And the key to digital behaviour change at scale can be summarised in the one word or metric of adoption. Is this something someone will want to adopt as part of their daily routine or life? Will they repeatedly come back and be supported by that? We've got a long way to go, but that's our future aim. What could a My LiveWell app that's adopted as part of someone's everyday life look like? Not seeking to replicate the likes of Fitbit, but complementing and working with those apps and wearables.
So just coming to the end then, if we go back to where we started from today, you'll recall we were obviously talking about Bastian, weren't we, and how his story became another person's and another person's, and his legacy kind of continued through many generations. And we've got an opportunity as well, not just to influence population health, but the health of our systems locally, and our NHS, our social care services, to committing to carry on writing our LiveWell Dorset story. And the only way we're going to be able to do that and that makes it sustainable is to use tech to support us with that. And so tech and digital behaviour change science, combining all of that together, that feels like the way forward for us. So just in summary, 3 kind of takeaways for you. The first is that digital technology and health improvement can and do go hand in hand. We're doing it and people want it, they are choosing it. If we don't embrace it, then we will lose people and probably miss opportunities. The second is that in the health and social care world, it's not just about the end user, although the end user is absolutely important and central. We've also got to think about other organisations and partners. And so when we're looking at new tech, please let's not work in silo. Let's be looking at what else is going on around us. Who are our key stakeholders and partners? What are they doing? And can we make sure that things are integrated? And then the third thing is, as Matt was saying, around user experience and research and testing, making sure that listening to your people is central to everything you do.
So we're a behaviour change service, so it's appropriate to end on a quote from Susan Mickey, one of the authors of the Behaviour Change Wheel and Conv. I think we can all agree that this is something we can't do enough of. To be open, to be reflective, and to be willing to take a step back.
Yeah, brilliant. Yeah, sorry, we've rattled through loads of stuff there at speed. We've obviously gone a couple of minutes over. There are about 300 other things we would love to talk to you about, including digital coaching, which we won't. So we'll leave it there. But thank you so much for listening. And this is to be continued, hopefully.
I think if everybody else on the call was as fascinated as I was, I'm sure they won't mind the few minutes over. It was really, really interesting. Thank you so much, both of you. Your absolute focus on user needs, demonstrating the real positive impact that you're having on people's lives was brilliant. And thank you for the shout out for James, and brilliant to hear Orca being kind of publicised as well. Really important that these apps go through some kind of research and evidence-based process before people use them. So thank you very, very much. If anybody did have a quick question, I'm sure you wouldn't mind, pop it in the chat. We'll just give you a couple of minutes to do that.
We're more than happy to take a question if anyone's got one, but
the recording will be available. Lots of positive comments for you both. Can you see the chat now?
I need to open it up. Let me open it up.
I love this one. Blown away by what you have achieved and continue to do. It really was a fantastic session.
Thank you, everybody.
Okay, so it doesn't look like anything is coming in. People, before you go, if you want to know more about Futurefest, please follow us on Twitter at Digital Dorset. And if you're doing any sessions this week, I hope you really enjoy them. So thank you.
Thank you, everybody.
Thanks. I popped our email addresses, so if you want to get in touch, feel free.
Lovely. Thank you both.
Thanks.
Thanks all. Great to chat to you all. Thanks.
Thank you.